Well, hello there, and welcome back to the Straight A Nursing Podcast. I'm Nurse Mo, and as always, super excited that you're here hanging out with me today. I've got a special treat for you today. We're going to be talking about being a nurse practitioner and what nurse practitioner school is like. Let's take a quick minute, though, to give a listener shout out, and I hope I say this right. This came through on Apple Podcasts, I believe, and it's from Han Palucci, who says, "This podcast has been incredible. I wish I had found it sooner than my last semester of my BSN program. As I'm studying for the NCLEX, this podcast has had wonderful pieces of information, and Nurse Mo just makes the process so much more enjoyable." So this review was left, I think, a while ago, and by now, you've already graduated, you've passed your NCLEX. I just wanted to say thank you so much for taking the time to submit that review of the podcast. So if you are a fan of the podcast, anybody listening is a fan of the podcast, please take a minute to make sure that you are following or subscribed to the show. That is the number one most important thing. That way you don't miss a single episode. You don't have to go hunting for the new episodes. They show up automatically for you on your mobile device every Thursday. And those bonus episodes that I like to throw in there once in a while, they show up as well. And then if you really love the podcast, going in, rating, and reviewing means the world to me. So thank you again to Han and to everyone else who's a fan of the show. So today we're talking about nurse practitioners, which are advanced practice nurses that really fulfill a very wide variety of roles in the healthcare setting. So having an NP license essentially enables a nurse to write orders, prescribe medications, diagnose health conditions, and in some states, you can even practice independently without any physician oversight. So I had the great pleasure of interviewing Latrina Walden. She is the founder and the CEO of Latrina Walden Exam Solutions, where she provides board exam resources for aspiring nurse practitioners. And she just has a lot of great information about the pathway to becoming an NP and what NP school is like. So if you've ever thought about going for that advanced degree and becoming a nurse practitioner, keep those earbuds in and let's dive into the interview. Okay, I'm so happy to have Latrina Walden here today. She's a nurse practitioner here to graciously answer all the questions that you guys ask about what it's like to become a nurse practitioner, what the job is like, how do you get there, all the good stuff. So, Latrina, I want to start by getting just kind of an overview from you. I'd love to hear kind of the trajectory that your nursing pathway took, what that looked like, how you started, and how you got to where you are today.
Absolutely. So, hey guys, I'm Latrina Walden of Latrina Walden Exam Solutions. I am a practicing nurse practitioner, and my trajectory for nursing is such a journey. But kind of the shortish version is I did not go to school to become a nurse initially. I went for my master's in health administration. I always knew I wanted to work in healthcare, so that's what I did. Ended up becoming a nursing home administrator first. And so I was that for many, many years, about eight years or so, and then moved to Georgia, where my mother was, and decided to keep working as an administrator. So I did. And I worked for DaVita, had a very supportive boss because I was in an environment where every administrator was a nurse.
Nice.
And said, "Hey, what do you think about me going to nursing school?" And she looked me dead in my face and said, "I think that's a great idea." And so I was always very nursing curious. I had initially wanted to go to medical school and just didn't want to pay all that money, to be honest. But this VP said yes. And I went. I mean, I literally was in school the next semester at one of the 2-year state colleges down the road from my clinic.
Wow. Perfect timing.
Yeah, perfect. And I had such supportive colleagues who were nurses. They would watch my buildings and all of the things. Like I remember having survey and being in class, and a colleague was like at my building was like, "Don't worry, I got it. When you get here, you get here." So it was pretty amazing. But went to a local 2-year school, got my 80 in, took the NCLEX, passed, continued working as an administrator. And then finally, after about a year and a half, said, I think it's time that I work as a nurse on the floor.
Okay.
And that is what I did. I left and I went to Grady Hospital. If you know anything about the Southeast, it is the largest hospital in the Southeast. It is a teaching hospital and it is where everything goes. So if you want to learn and want to learn fast, that is where you go. So I am an ER nurse by trade and learned like everything. I probably saw everything you guys ever wanted to see in that ER. It was an amazing experience.
I bet.
It was so fantastic. I can't say enough good things about it. But anywho, while in school, got my bachelor's. So I did that. And then since it is a teaching hospital, that means I have residents. And so my residents were great, but I also started anticipating what they would order and why they were ordering it.
Mm-hmm.
And so that is kind of the natural progression. And I like autonomy, right? I came from being an administrator.
Yes, absolutely.
So I like being in charge. I like running things. That is my comfort level. So what can I do and utilize my skills and progress to the next level? Well, naturally, I can become the provider. I can become a nurse practitioner. So that's what I did. I entered into school. And I went to a local state school here in Georgia. It's down south at Albany State University, but decided to go to school and did that and worked. And I did stop working partly in school. And, in between all of that, I was also a professor at a 4-year university. I know. I do all the things.
That's a lot.
It is a lot. And that's how I kind of became the nurse practitioner, but also started my company as well.
That is... You're a busy lady. I can tell right now.
Yes.
But I love it. I love that you had that support from the very beginning. You had mentors, you had people that were role models, and you went through it. And then you never stopped learning, and you knew yourself really well. Because you obviously said, hey, I like autonomy. I like being in charge. I like anticipating what the patient needs and writing the orders. So, hey, this is the perfect career choice for me. So what area of nurse practice? I almost said nurse practitionering. And as it was coming out of my mouth, I realized that's not a word, Mo. Are you a specialist? Do you work in the ER? Like, where do you work as a nurse practitioner?
Yeah, no, I initially wanted to work in ER, but I am family. So I am a family nurse practitioner, which is pretty common.
Very nice.
There are different tracks. There are definitely different tracks, but that's the pretty common one.
Okay.
And I just work right now I work in a volunteer kind of capacity. So I work at a free clinic.
Nice.
Where I'm able to volunteer my time because obviously with running my company, I don't have to work that full-time role.
Yes.
That needs to, but it's also very fulfilling for me because I get to work in that type of environment, right? Helping lower income patients.
Love it.
And I'm their last stop. So my patients don't have any money, so it's like, telling them to go get an x-ray is a thing, They don't have $10.
Yeah, that's a big deal. Yeah.
Yeah, it's a huge deal. So I relish in it and I love it. So.
Okay. I love that there's so many different things that somebody can do with a nurse practitioner degree. And we'll get into that because I know a lot of times students, they've heard of a nurse practitioner, but they maybe don't realize the very many things that you can do. But I want to start like even before that and say, let's say that I've got a student, and this is a very common situation. I have a lot of students who are like in that first year of nursing school or just even thinking about it.
Yeah.
What can they do at this very early stage to prepare? Like what kind of mindset, what kind of, I feel like if you're going to go for an advanced degree, you got to be pretty high achieving from the get-go. But that's my perception. I would love to hear your actual knowledge.
I will tell you that I am very pro nurse practitioner, clearly that's what my company is built on. Very pro clinician. However, I do understand that it is not for everyone. So it is not the natural progression for everyone. You do not have to become a nurse practitioner in order to go to the next level of nursing. And I want to be very clear about that, because people feel like they want to be an NP and then they get an NP school and they hate it, or, they're just not having a good experience, or they become the NP and they don't like it. And that's okay. You can do other things. But if you are choosing that journey and that is what you think that you really want to do, please understand that you will have someone's life in your hands. It is you that will be making the decisions. It is you that will need to confirm or deny any diagnosis that is going on.
See, I don't need that kind of pressure. To me, that is terrifying. I'm so thankful that there's other people that want to do that. Like, I'll make my nursing decisions, fine, but being that final word, that's a lot of responsibility.
It is a lot of responsibility. And I think that we don't need to take that lightly, right? Because I mean, that's where you get questionable practitioners, is they think they know. And, I get a lot of students sometimes going, I'm starting my first job and I am very nervous about it. Like, I am scared. And I'm like, you should be.
Yeah, absolutely.
You should be nervous. But at the end of the day, you do trust your training. You have gone through clinicals, you have gone through school, and you have your nursing background behind you. And most of us are coming from some type of hospital setting. Most of us.
Yes.
So you can rely on that, but then couple it with your nurse practitioner skills that allow you now to diagnose and get labs and things like that. And you will be fine. It's like running a marathon. Trust your training. You did the work.
I like that. Trust your training. I like that.
Yeah. And then find mentors. I'm a big proponent of that. Find mentors, find a community where you can be around like-minded folks so that you can ask those questions, because we all have those times when we're like, listen, I don't know what's going on with this patient.
Right.
Have you ever experienced this? Do you know what lab I should run? In addition to looking things up, obviously, but find your community and find your people.
Okay. I love that. And I don't think it's too early for someone to start that.
I don't. I actually have a community. So, fun fact. I do. I have it's called MP Collective, and it is.
Oh, I love that name.
It's only for those who have a license.
Nice.
And so you don't have to have an NP license. You can be in school attempting to do that. But again, it's just an area where we can commune together and not be on Facebook and be scared to be screenshotted into the atmosphere and be talked about by these physicians.
Yes.
You know what I'm saying?
Yes, I love it. I just love everything about that. So let's say you were talking to a nursing student and you were trying to convey, these are the traits that make for successful NP students and successful NPs. Now, you already said autonomy, and I think you touched on loving to learn. Anything else that you would say, if you've got these traits, you're probably going to be, you're going down the right path?
I would say be inquisitive. I just told some folks the other day, because when we're trying to find that diagnosis, you cannot be afraid to talk to your patients.
Yeah.
And sometimes that may be with uncomfortable things. I always say, guys, if you aren't talking to your patients about sex either, you need to, that is not off the table. And remember, a sexual patient is a happy patient. So you need to be asking all the questions. So being inquisitive is important. Being able to, even though we work alone for the most part, we still work on a team. This is still a team effort.
Okay.
So you have to be able to be approachable and collaborative and those kind of things, and be really good at putting together puzzles.
Love it.
Yeah,
okay.
Because if you're specializing, you're definitely putting together puzzles.
I would say so. Okay, so we've got inquisitive, we've got collaborative, and we've got puzzle master skills.
Right.
Okay.
How do you put that?
Okay, I love it. I think that's great. I think, a lot of students that I meet fit that criteria. A lot of nurses I work with meet all of those things, and they would make great nurse practitioners. I wish more people looked into it. I know a lot of times, especially once, and you were absolutely there, once you're working and you think about going back to school, the thought of taking that on can feel overwhelming, but
I understand it. Sometimes I tell people all the time, like the thought of going back to school gives me a visceral reaction.
Oh, yeah, me too. Like I did a graduate program in nursing education, which is, in my opinion, probably nowhere near as difficult as a nurse practitioner program. And I also am like, I'm done with school. I'm done. I'm good.
Right.
But
good.
Okay, so let's say, here's another thing that comes up all the time. Like there's a debate, right? People get heated about this one. Direct entry nurse practitioner versus you got to have some experience first. Yeah. What do you say?
You are so right, Martin. You are getting into it, aren't you? You're trying to get me in trouble.
No, no. I'm just really curious because I could see, I know people that have done both.
Yes. So do I.
Yeah.
So do I. I really think, so all old school nurses are going to tell you need experience, right? You need to get out there. You need to practice a little bit. I'm going to be honest. My personal preference is that you do get experience, that you work on the floor. And why is that? Not to say that nothing's wrong with, going to direct entry, but those assessment skills.
Absolutely.
That is the key right there.
It's your number one job. It's your number one job.
That is it. And as an NP, that is so key to you figuring out this diagnosis.
That puzzle.
Oh, man. It is so key to you figuring out what is going on with your patient. Because, patients don't talk in concrete words like we want them to. It's like, how long have you been using your inhaler? I don't know. I use it a couple times, I guess. I'm like, what's a couple times? Is that 2? What? Give me a number, 2 or 3, So it's the assessment skills. However, I do know that the direct entry programs are becoming more and more popular. And it is something that people are doing. Yes. I just highly encourage that if that is what you do, and I understand why people do it. So that's why I'm not completely against it. You know what I mean? But if you do, make sure that you do work on the floor for a bit, or you get some kind of experience on the floor, because it's the assessment skills. Yes. That's where your strength is. I don't care if you're a nurse or you're a nurse practitioner. Your assessment skills are where you're going to walk into that room and be like, I don't know what it is, but something's wrong with this patient. Yep.
That'll make or break you.
Yep.
That one skill right there.
Yep. So it's being able to do that is where we're finding we want the experience,
Yeah. Okay, great. All right. I would love to hear, and I'm sure the students listening, especially those that are like in nursing school right now, maybe don't know what nurse practitioner school is like. Can you give, I realize different programs are probably structured differently, but can you give kind of an overview of what a program is like?
Yeah, it sounds funny, but I want you to imagine taking your entire nursing school and putting it online and basically learning how to diagnose, what labs to do.
And the pharmacology.
Yeah, and the pharmacology that goes along with it. I mean, it's complete. Most MP schools, let's be honest, most MP schools are online, whether or not you go to a brick and mortar. Yeah, you have some schools that are out there that do intensives, meaning they meet, on the weekend, or maybe meet once a month or something like that. But by and large, most MP schools are online, which means you may not ever see your classmates except for at graduation.
Oh, my goodness.
A lot of schools, they are not, you do not get a lecture every week or anything like that.
Man, I'm already feeling nervous, and I'm not even considering it. Like you have to have that. You have to have that tenacity and that to really do it. A lot of these programs are what a lot of MPs consider quote unquote self-taught. Wow. Okay.
But there are some very, very great programs out there at brick and mortars that do make it a point to have lectures, if not every week, every 2 weeks, that do try to make sure they give you as many touch points as they can, that they are very, like almost over communicative about the information that you are getting and the learning that you are receiving.
Okay.
So you really have to do your research when you're choosing a program.
Okay. And I imagine, for some people, a fully online program, if they are juggling work and a family, that could be great for them if you've got that discipline to do it. That's where I would be like, I don't know if I feel like doing it today. So I know that about myself. I would probably do better showing up and being in person, but some people do better in the other programs. So that's nice to know that there's options. And then I know there's clinical, probably, I hope a lot. How does that work? I feel like, correct me if I'm wrong, but nurse practitioner students arrange their own clinicals?
Okay, so this is a big hotbed of controversy these days because, again, by and large, probably about 80%, 90% of the programs out there, you do have to arrange your own clinicals. You are required. Your school will likely do a minimum of 500 hours, could be up to 600 hours.
That's a lot.
Mm-hmm. Yeah, and it's spread out over the semesters, right? So, but the kicker is a lot of these programs are making you find your own preceptor. So what does that mean? That means I have to call before every semester or line them up a year in advance.
Wow.
All these doctors' clinics, finding other NPs, hospitals, and approaching these providers and saying, hi, I'm Latrina. I'm a student in NP school. Do you have room for me as a preceptee?
Wow.
Do you mind being my and that's where the struggle comes in, because if you don't find one, you can end up sitting out a semester.
Like it concerns me for the student who's in an area where there isn't a lot of access to healthcare.
Yeah.
So there might be
travel.
Yeah, there might be like one clinic in their town, and that would be that would be tough. Probably easier in a big city, a big metropolitan area. But then you've got a lot of competition because there's probably a ton of other nurse practitioners too. So you got to network and you got to advocate for your own education. And and I guess that makes you a good
comes in, Maureen, because you got to, and like you said, if you're a good nurse and you've been at your facility for 8-9 years, I hope you're a good nurse who knows the physicians as well.
Yeah.
Or a good nurse who knows the NPs that are coming on your floor or in your clinic as well, because those are the people you need to be asking.
Yes.
And they will book up to a year in advance.
Oh my goodness. Yeah. I have a friend who had to change paths completely because she could not get a clinical placement during COVID.
It is very common. It is very common to get frustrated. Now, there are absolutely schools out there who will find the preceptors for you.
Wow.
But that means you have to live in the area, right? So Emory is one of those schools. So Emory University, if you want to go to Emory University, MP school, super competitive, very, very expensive, and honestly, a great program. They will find, they have a whole hospital and all these multiple clinics. They'll find your preceptor for you. They will place you. However, if you don't live here, let's say you live in California and you're going to Emory, what are you going to do? You got to find your own stuff. So, you have to think about things like that, and some people have to pay.
Oh,
yeah. What? Yeah. It gets real dicey.
Okay. So there's a lot of things to take into consideration.
Absolutely. Yeah. Absolutely.
Okay. Thank you for that. Cause that is an eye opener for me.
Yeah.
So my next question was going to be, what do you look for when choosing an NP program? So I imagine, okay, that's one, right?
Yeah.
Will they help you find your clinical placements, or are you on your own? Is there a fee involved? What? And then I'm sure there's other things too. What else would you look for? Online versus brick and mortar? What other things are important?
I would look at that. So, I'm a big proponent in not having to pay an arm and a leg for education if you can help it.
Oh, yeah. Yeah, me too.
So I would absolutely include price.
Okay, good.
I would include kind of that didactic learning, which is basically, are you getting the lecture or not, per week? Those are questions that you can ask admissions.
Yes.
In the nursing school. But that's important, because do you want to be doing it on your own, or do you need some guidance?
I need guidance.
Yeah. So those are really the kind of the top points. Can you help me find my clinicals? Price. What does the lecturing situation look like?
Okay.
Yeah.
Okay. Very, very good. And then, okay, we talked about that. I'm just looking through my
Yeah.
questions. You've
No,
like
you're fine.
preemptively answered a bunch of them, which is
Yeah.
fantastic. I love it. Okay, so let's talk a little bit about just the like many different kinds of environments where an NP could work. My
Oh,
experience
yeah.
is just what I've seen, right? Like I've got NPs at the hospital, and then I've got like my doctor's office. But I know even within that, there's specialties you can specialize,
Absolutely.
and you can start your own business and like all kinds of things. So, what would be some career opportunities with a nurse practitioner background?
Quite frankly, it is all of those things you mentioned
Mm-hmm.
and probably things we can't even think of right now.
Yeah.
But kind of the top ones, obviously hospitals.
Okay.
That is a big one. And how that works is basically they're working with the physicians in their office and they're rounding on the
Mm-hmm.
patients in the hospital. Medical clinics, nursing homes. Nursing homes is getting kind of big, actually.
Is it? Okay.
Yeah. So instead of the doctors rounding in the nursing homes, we're finding that the nurse practitioners are rounding in the nursing home. The doctors are
Okay.
hiring the nurse
Mm-hmm.
practitioners.
Okay.
So that's a big one. You can work in farms. So like sales, if that's your
Oh,
thing.
yeah.
Yep, that's a big thing. I'm seeing a lot of school nurses being NPs as well.
Oh, really? Well, you know what? It
Yeah.
kind of makes sense because being a school nurse, you're out there and you talk about being on your own. And anything could happen, right? Anything could
Yeah.
happen. There's kids going to school with all kinds of,
Man,
comorbid issues,
right,
cardiac
all these
issues,
allergies running around.
diabetes, seizure disorder, like anything.
Yes.
Traumas could happen. So
Yes.
I think that's probably good. I like
Yeah.
that.
Yeah. So that's a big one. But also, if the school nurse is not the NP, the person over the school nurse is usually an NP.
Mm-hmm. Okay.
So that's a popular one. You could do, obviously instructors,
Uh-huh.
teaching. That is also a big one. A lot of NPs teach as well.
Yes, I
But
got a lot of my nursing school undergrad education from some great nurse practitioners. It was fantastic. I just loved they could really bring that clinical side, and they have the best like patient scenario stories because that's the sort of thing that brings it to life, right?
Right.
Yeah,
Right.
so
That's how the
great.
students remember, right? You tell a story and they're like, that's not true. And it's like, oh no, it is.
Oh yeah. And there's more where that came from.
Right. Right. So that's very common. And then the one that you said, which is a big one that people are doing, which is opening their own practice. That's a big one as of late.
Mm-hmm.
As of late, everyone wants to be an entrepreneur.
Yeah. And it could be all kinds of practice. It could be a women's health clinic. It could be a family practice. It could be the place. Okay. I'm going to out myself here. The place where I get my Botox. Okay. It's run by a nurse practitioner. She saw a need.
That's actually really common because, the aesthetics.
Yeah.
In many states, it allows, like, if you're an NP, like, you are the person. Like,
you do all the things. Yeah.
You do all the things. Right. Yep. So it's super common. But even if you don't want to own your own clinic, just opening up any kind of entrepreneurial space, that's a really big deal for NPs right now.
Yeah.
So, yeah, I mean, really, it is wide open. Research is a big one as well because they're always. I
like research.
Yeah. So if working with the patients is typically not your thing, but you still want that clinical education, then we always have clinical trials and things going on.
Yeah, going into research. Interesting.
Yep.
Okay.
Yep.
Very cool. I like you just opened my mind to the whole thing. I mean, I'm not going back to school, but it excites me to think about all the opportunities that my listeners are hearing about. And I think you probably just inspired quite a few people. I do want to hear more about your company and how you help nurse practitioners.
Absolutely. So I am, my company's name is Latrina Walden Exam Solutions. And so when you are in school and you are at one of those schools where you're maybe not getting the lectures that you need or the information is being told to you, but it's still some big complex situation and you're not quite understanding. that's kind of where I step in.
Okay.
And because the way that I teach and I explain is I'm able to take these big concepts and bring them down, and we use layman terms and the light bulbs go off.
Yep.
And so also they are, it's like I call it like a digital study guide.
Mm-hmm.
So my main thing is to help you while you are in school. It just basically goes along with your schooling. You can listen to me, you can watch the PowerPoints and all that kind of stuff. And then when you're ready to test for boards, because we have to take boards just the same.
Yeah.
It is very different from the exams that you get in school. And so when you are ready to pass your boards, that's where you reach out to me as a program and say, hey, what do you got? Because we have several programs that can help you pass boards. So that's what I do. I just try to help transition folks from school into an MP, and then from MP into an expert MP.
Fantastic. Yeah. And where can people find you on the world of the internet?
On the world of the internet, you can go to Latrina Walden Exam Solutions.com, the whole thing. And I just do want to point out that my email on our company and how I've built things, they are very supportive. So if you do have questions, please reach out. You can find me on Instagram, LinkedIn. It's all the same. Latrina _Walden _NP. On LinkedIn, it's just Latrina Walden, obviously. Mm-hmm. But on Instagram, it's with the underscores.
Okay, got it.
But yeah, if you have questions, I constantly am talking about the education that we need to know as clinicians, as nurses, just in general. Mm-hmm. So come hang out with us and learn all the things.
That sounds fun.
Yeah, it's a lot of fun.
Okay, and I'll put a link to your site in the episode notes. So if anyone's driving right now, don't feel like you have to get injured writing it down. So I'll include the link to that. And I just want to thank Latrina for taking the time out of her busy schedule to share so much about the whole world of being a nurse practitioner and all the cool things that you're doing to help people reach that goal. Thank you so much.
You're very, very welcome.
Wow, I learned so much in that interview with Latrina, and it really did open my eyes to the nurse practitioner journey and some of the really cool things that nurse practitioners are doing. So next week on the podcast, I've got a really fun episode for you, and this really came out of my own experience being a nurse in the ICU and now in the recovery room. You know how sometimes there's stuff and you think, I should probably know what that means. I'm sure I knew it at one point, probably in nursing school, but now I've forgotten, and I don't know if I should ask somebody because then I'm going to look really dumb. Okay, first of all, you're never dumb for asking a question. Please always ask questions. But I get it. Sometimes you're like, I might just go look this one up on my own so that I don't feel foolish. So what we're going to be talking about are just some of those things that you probably are too embarrassed to ask. So that'll be a fun one. I can't wait to share that with you. So make sure you're following the show, subscribe to the show so that it shows up for you like magic next Thursday. I'll see you soon. Bye for now. This podcast is brought to you by Straight A Nursing.